I'm Dr. Varun, pediatrician and a pediatric pulmonologist at Apollo Vanagram, Chennai. Today's topic for discussion will be pediatric asthma. Now, coming on to asthma, it is not the same as adult asthma. Asthma in children, we actually call it as more like wheezing, okay? We don't call children less than 6 years as asthma. We generally call them as wheezing and more than 6 years as asthma. That's why we see many children who often get nebulizations and suffer with wheezing up to 5 years. But many of them actually improve throughout their life, and they don't even face this kind of wheezing or asthma in their later life, okay? So whoever children who develop wheezing in the last 5 years of age, they need not necessarily turn out to be asthmatics in their later life and adult life. This is the most important thing. So how do you detect asthma in children? There are only 2 or 3 symptoms is very, very important, okay? Observe your child's sleep at night. If he coughs too much at night, especially midnight and early morning, 4 round to 6 pound, the cough which does not let him to sleep. This is the first and foremost symptom. Second thing, a cough which disturbs his play or exercise. A child goes for play or he goes for running, but he keeps on coughing and he's not able to see. So we have understood what is asthma here and what are the main symptoms of asthma. And sometimes you can also see very fast breathing, and you can also see some indrawing here going like this. And these are all supportive measures which you can find in any child with asthma. But the most important investigation which calls for asthma is spirometry. For more than 6 years, we do a lung spirometry, and for less than 6 years, we do a test known as impedance oscillometry. This is a very new technique. Previously, we were not having this impedance oscillometry. More than 6 years, children for spirometry, you need to do with some effort actually. They'll have to blow into a device, which is very difficult for less than 6 years. Whereas for less than 6 years, this impulse oscillometry, they just need to sit idle for just 30 seconds to 1 minute. So coming on to treatment, as I told you, you'll have to detect which is wheezing or not. And you have to avoid these cold kind of items, which I already told you. And for treatment, we'll use special medications and for nebulizations, etc., which I already told you in detail. Thank you.